The rapid spread of the Omicron variant is severely straining our nation's hospitals. The Department of Health and Human Services is now reporting more than 145,000 COVID-19 hospitalizations. That figure has surpassed a previous peak from last January. Meanwhile, lawmakers grilled the nation's top health officials on Capitol Hill over the Biden administration's handling of the Omicron surge. It comes as the CDC weighs new mask recommendations for Americans. CBS News correspondent Elise Preston begins our coverage from Chicago.
As the Omicron variant wreaks havoc on our nation's health system, tension on how to handle the surge is spreading too.
You are making a catastrophic epidemic for your political gain. So the only
have
thing
politically attacked your colleagues.
During a Senate hearing, Dr. Anthony Fauci accused Senator Rand Paul of raising political donations with personal attacks.
That kindles the crazies out there, and I have threats upon my life, harassment of my family and my children with obscene phone calls because people are lying about me.
Tonight, COVID hospitalizations are rising in 43 states. Medical centers are treating more than 116,000 inpatients a day, a 40% jump from just last week. And as COVID cases have quadrupled in about a month, the CDC is considering a change in its mask recommendations, backing N95 and KN95 masks, which offer the best protection. According to the CDC, a person wearing a cloth mask standing within 6 feet of an unmasked individual with COVID can become infected within 20 minutes, while it would take 2.5 hours for a person wearing an N95 mask.
Typical cloth mask might be 50% effective, and that was okay before. It doesn't seem to be enough with Omicron. An N95 offer much greater protection. They're able to block 95% of particles.
Still, there are signs that the surge of Omicron infections may have crested in the Northeast.
Cases are slowing down. The rate of increase is slowing down, but they're still high.
With testing among the first line of defense, at-home testing kits remain in short supply and testing lines long. Doctors warn, stay away from overcrowded hospitals.
There's really no need to come to the emergency room just to be tested. You're going to take up resources and space that are needed for people who are more sick.
People will soon get a little relief when it comes to at-home testing costs. Starting Saturday, Americans can get reimbursed for 8 tests a month through their private insurance. And a new real-world study shows the Abbott Binax Now test can detect the vast majority of people with Omicron. Lilia?
Elise, thank you. For more, I want to bring in Dr. Adam Brown. He's an emergency physician and the National COVID-19 chair for a task force at Envision Healthcare. New data from the Department of Health and Human Services shows more than 145,000 Americans are right now hospitalized with COVID-19, which, as we said before, surpassed a previous record that was set a year ago before most people had their vaccines. Doctor, do you expect that this number is going to keep getting higher and higher?
First, thanks for having me on tonight. Unfortunately, the answer to your question is I do expect that number to get higher. As we see cases rise in other parts of the country, and as we see cases drop in areas like New York, which you just highlighted, there's a lag in hospitalizations that typically comes about a week to 2 weeks following. We've seen that in other waves. Now, Omicron tends to spread much more quickly, but we still believe that we'll start to see even a higher increase in hospitalizations around the country in areas that are just starting to see their wave of infection. So sadly, there's more to come.
Well, that's not a very hopeful thing to look forward to, but hopefully we'll get a hold of the pandemic eventually. Now, as Elise mentioned, the nation's top health officials, including Dr. Anthony Fauci and CDC Director Dr. Rochelle Walensky, testified before the Senate on the Omicron variant. Now, you as a chair of a national COVID-19 task force, how do you see this? What's your assessment of how federal health officials have handled the Omicron variant so far? What's your critique, your take?
Well, first, I do think this is a very challenging type of pandemic because the spread is so rapid. And the realities on the ground in different parts of the country can be very different. For example, one area could be facing a significant rise in the number of cases, whereas another part of the country may not. But what we have to remember is that anytime that you're giving public policy advice, that advice needs to be very simple, technically sound, also very practical, and there needs to be engagement of stakeholders around the country. So I think it's good that they are there speaking before Congress to give answers to how we are doing. I also think it's important that the administration is recognizing the necessity to give testing around the country to those who have insurance. But I caution folks, because not everybody has insurance. Not everyone has access to a health insurance plan. And so for the 10% or so of Americans who are uninsured, I'm concerned about them and where they are going to get their tests. So it's a step in the right direction, but it's not quite as far. And as for masking, this is also a good step in the right direction. We know this virus is airborne, and so the necessity has been there for some time to shift away from cloth and surgical masks to KN95 and 95 masks. We need to do everything we can to stop the transmission of this virus or to bring it down so that we can protect our healthcare system right now.
You know, the masking bit was so discouraging for so many of us because you think, well, at least I'm somewhere where people are masked, to now think about, well, it's more contagious, it's less effective. Is my mask right? I was looking for masks online yesterday and I couldn't find N95s in the site where I usually find them. So it's a tough time for that. Now, the WHO is warning against treating COVID-19 as an endemic illness like you would the flu. It comes just as some countries like Spain are pushing for a change to the way that governments track the virus. Why might it be too soon to transition from pandemic to endemic?
Well, it's definitely too soon right now here in the United States and a few other countries around the world because the significant amount of disruption that the virus is causing. When a virus is more endemic, people are living with the virus more and the disruptions are much, much more minimal. Hospital systems and patients, as well as general populations, are able to deal with the inconvenience of having the virus. But now that is certainly not the case with schools debating on whether or not to return, with hospitals having to consider staffing mitigation techniques, and with the number of flights being canceled and just the significant burden that's out there on even our supply chain. So we're not there yet. But we do have to walk and chew gum, meaning that we have to take care of the immediate issues now while also planning for the future of when the virus does, hopefully sooner rather than later, become endemic. And so having a plan in place is a good thing. However, we have to recognize the realities that are there on the ground. And this virus, Omicron, is creating significant disruption in our life right now. So it's far from endemic.
So it's starting to make a plan to think about psychologically, at least, what a world would look like if COVID is always around, but we're not there yet because of this variant. Got it. Well, the pandemic has also led, as Nora O'Donnell reported, to a significant drop in blood donations. The Red Cross has declared a national blood crisis. How does a blood shortage of this magnitude impact hospitals and patients, of course?
Well, it's significant impact because then we have to start making decisions on who can and should not receive blood. So whenever we have a bulletin like this come out from the American Red Cross, we need to take notice to that. So what I need everyone to do today is to search online at your local Red Cross or your local hospital and find a way for you to be able to give blood. That's an important step for you to not only protect your community, but also help support this cause right now. But I also encourage hospitals and also the U.S. government and locales to think about ways to incentivize giving blood, because those incentives do work in getting people out there to give blood. So I think those are some of the strategies that we need to do, but I do need everybody to go out there and look for ways that they can give blood right now because there is a significant shortage.
Well, Nora sure invited us all to do it, and I'm hoping that influencers out there on social media will maybe do a blood donation challenge, and then everybody will follow as well.
Great idea.
Dr. Adam Brown, thank you so much for joining us and for your guidance.
Thanks for having me.